Hello, and welcome to the Postpartum Years podcast. Welcome to part 2 of Bev's story. She has a third child, and this pregnancy went well. The postpartum process went quite well, but what happened postpartum is another story. So I hope you enjoy the continuation of Bev's birth stories.
Started dating again a few
Good.
years later. Yeah. And met my current husband, who is definitely the love of my life. And he was, I think it was 37 when I met him. We were dating for a while and, quickly realized that we were each other's people. Got engaged quickly, but a few months after that, and got married. And I had told him, he had no children, no biological kids, and had always wanted some. He's a geneticist, and he was like, I have to pass on my genes. Like, this is what I'm supposed to do. So I told him, well, this baby factory is closed at 40. So if you want to have a kid, it's going to happen before 40. It has to happen before 40. So we got married. I was 38. We got married, and 39. No, 38 when we got married. And quickly after that, got pregnant and was excited. Got that positive test and told him immediately. And I was like, oh my gosh, positive test. Yay. And we were really excited. And a couple weeks after that, I had cramps, started bleeding, and was like, well, sometimes this can happen. Sometimes there's, a little spotting. And then it was definitely not. It was full blown, the worst period, like the pain, the amount of blood. It was a lot. And at that point, I went to my gynecologist. Well, I hadn't even gone for my first appointment yet for my initial OB appointment. So I just went to my gynecologist. I made an appointment, and she was like, well, they did a blood test, and they were like, well, yeah, well, you are positive, but you're bleeding this heavily. Chances are you're having an early miscarriage. So, or they said chemical pregnancy, early miscarriage. It was very hard for both of us, knowing that it could have been life, did not end up happening. But, being who he is, he was like, well, maybe there was some genetic abnormality, and this is the body's way of, correcting that abnormality, and scientific.
Yeah.
Talk
I'm married
there.
to one of those too.
Yeah. But that didn't really help my
No,
feelings.
it does not help your
No.
heart one bit.
No, not at all. Yeah. So that was sad. And I went into a bit of a, eating frenzy. Like, I am an emotional eater for sure. And I wouldn't say that I was depressed after that. It wasn't like postpartum depression, but
Grief.
I was sad. And yeah, grief. And I immediately went into, how do I cope with these feelings? I comfort myself with comfort foods. And then I gained 25 pounds in just a few months. I gained 25 pounds and then pregnant again 3 months later. And I was 25 pounds heavier. So I was on the almost obese line of pregnancy and 39 years old. So it was scarier. I found out I missed a period and took the test, and I was like, I'm not going to tell anyone. We're not telling anybody. No moms, no friends, nobody. I told him, and we didn't tell anyone. I went into the advanced maternal obstetrician, and things were looking good. And I did the blood tests for the abnormalities and all that early. And we waited until we got those results back, which was about 12-ish weeks. Everything looked great. It was a girl. And the rest of my pregnancy was pretty good. I love the feeling of having a life in there and having the round tummy. And I loved it. And I was active. I was relatively healthy, except for those extra pounds that I could definitely feel this time. The pounds and the age definitely were, it was a lot different than being 31 and 25 pounds lighter. Yeah. So, pregnancy was okay. Around in my third trimester, I can't remember the exact week, went in for the glucose test,
Mhm.
and they determined I had gestational diabetes. Diabetes does run in my family. My mom had gestational diabetes when she was pregnant with me, and still has diabetes to this day. I was really worried about it and started taking medication for it and checking my blood sugar and trying to do all the things to help the baby be healthy. And it was a struggle because, I, being pregnant and having those pregnancy cravings or just regular cravings and feeling like I couldn't have pizza. I can't have two slices of pizza. I have to have half a slice of pizza when I eat pizza now. One bite of cheesecake, like I couldn't, I felt like I couldn't enjoy I'm a foodie. I love to eat. So that was difficult, but I wanted her to be healthy. So, and they also said that if it got to a point where I was close to 40 weeks, that they would schedule induction again. Well, not again, different doctor's office. And I definitely did not want, been through the Pitocin twice already. And no. So I did all the things that you say don't work. I did all those things. We had lots of sex. I went swimming. I did curb walking daily. After 38 weeks, I did curb walking. I did castor oil. I did evening primrose oil and raspberry leaf tea. Like I did all the things simultaneously to try to encourage her to come early. And lo and behold, 38 weeks and 4 days, I was standing in line at Popeyes for a spicy chicken sandwich. I was like, I'll just have half of one. And my water broke. And that was the first time my water had ever broken naturally. So, it's not like how it is in the movies. You know how you see the movies and there's like a gush of water and it's like a puddle on the floor? I was like, am I peeing myself? Why? I feel wet and warm. I think I'm peeing myself. And went to the bathroom and nope, it was not urine. And back out to my car and it was, I had been feeling what I thought were Braxton Hicks contractions for a few days prior. So then I realized, oh no, that's an actual contraction. They came pretty fast after my water broke.
Cool.
But I was like 20 minutes from home and needed to get home. So I drove myself home while having contractions. And that was an experience. And also on the phone with my husband, trying to say, hey, I think I'm having a baby. Where are you? Can you meet me at home? Yeah. But the contractions started coming pretty fast, pretty regularly, decreasing in spacing. I went home, took a shower, did the things that I know I may not be able to do at the hospital. Got my bag ready. At that point, it maybe had been 2 hours of contractions. And on the way to the hospital, called the OB's office, and the OB said, well, don't go to the planned hospital. I have privileges at this other hospital. The hospital you want to go to is full. So unless you want to give birth in the emergency room, I suggest you go to the other hospital that's another 20 miles away. And I was like, okay, sure. I mean, my last pregnancy is 14 hours, 17 hours. This is going to take a long time. It's fine. It did not take a long time. I was in the car. I had done hypnobabies again, refreshed myself with hypnobabies. But on the way, I was like, oh my gosh, I'm going to have this baby in the car. There was traffic. My husband was like, are you okay? I was like, don't talk to me. I don't want to hear anything. I just nothing. Just get me to the hospital. I got to the other hospital. They're doing the intake, like, how are you doing? What's your address? And I'm just like, I'm going to have a baby. I don't want to talk to anyone about anything. So he's trying to answer questions, and I'm like, this baby's coming. We get back to the like intake room, and they check me, and I'm 8.5 centimeters already. And I'm like, okay, get me to a delivery room. I don't want to have her in the ER, in the intake like
Triage.
rooms there.
Yeah.
Triage, that's what it's called. Thank you. In the triage room. So they get me into a room, and, I bounced on the little ball thing for maybe 15, 20 minutes, and then was ready to push. And beautiful, wonderful baby girl, not big at all. Thankfully, she was only 6 pounds, 5 ounces. She was
Wow.
pretty small. And I think that doing the limiting of food, limiting of carbs, was really helping. So she was born, and she was healthy, and things were good. I was moved to my regular room, and was comfortable. Things were fine. The lactation consultant came in, and the specialist was like, how are you doing with breastfeeding? And I showed her, and she was like, oh, you're a pro. And I was like, yep, things are fine. Things were great. It was just great. Uh, Immediately, I was like, I want a duck donut and pizza. You have to go get me those two things. And he went out and got me those things, because I hadn't had either of those in quite some time. And things were good. Got back home. And you know how they tell women that they should rest after they give birth?
I don't know how when you have like other children.
Yeah, yeah. I don't know how that's possible, but I understand why they say that, because I did not do any resting. Immediately went into momming, and still doing the cooking and the laundry and I immediately went back into my regular role. And I had given vaginal birth for a third time. And so it was painful. And I just didn't rest.
Hmm.
And, 2 days in, I went to the bathroom, was on the toilet, and I kind of felt not a pop, but I felt something internally. And I looked into the toilet, and there was just blood just rushing, not rushing, trickling into the toilet. I thought, that's weird. Because things were starting to slow down
Hmm.
at the end of day two. And I got up and like walked into the bathroom, and then I saw like a trickle, like it was like a slow faucet running down my leg and puddling on the floor. And I was like, something's wrong. And I called my husband, and he came in. He was like, oh my God. He just stood there. And I was like, I think I have to go to the hospital. I don't know what's going on. So I put a towel between my legs and immediately went downstairs, told the other kids, Grandma's going to watch you. Mom came and to watch them, and the towel. I was like, whatever you do, don't let the kids go in the bathroom upstairs. Just don't let them go in our bathroom, please. Because there was a lot. And he took me to the hospital, dropped me off into the wheelchair, and was starting to feel woozy. Got back into triage. I don't remember everything that happened, because I was kind of going in and out. They checked my blood pressure. Blood pressure was low. It was, oh my gosh, I'm about to start crying now. Quite traumatic. Traumatic for me, but also for him. Lots of doctors and nurses and came in trying to figure out like what exactly is wrong. I had almost forgotten what the pain of childbirth feels like until a hand inside of me trying to feel around and pull out anything that they could pull out. Um, they got some clots out and things like that. But I mean, I could feel the pool of the blood pooling under me as I was laying on the hospital bed, asking me to lift up so they could change like those pad things underneath and put another one, change it again, put another one, change it again. And them just trying to figure it out. They called my OB. My OB came. The OB on call was not the same that helped give birth. And she came in, and I remember her saying, you know, did you call for a sonogram? And they said no. And she was like, why not? Get a sonogram tech in here. And she said, did you order blood? They had not. And she was like, get her some blood because she's losing too much. And then I don't really know much of what happened after that. Much of what happened after that is secondhand from my husband, but basically she was like, oh, I do remember. She said, at some point, I want to take her up for surgery. I'm just going to do an kind of exploratory surgery and just see what's going on because they had done the sonogram and they couldn't see anything that would be causing that amount of bleeding. I remember being wheeled in the stretcher, and apparently they didn't want to take me immediately because it was COVID. They were waiting for my COVID test results. And I remember her shouting, my OB shouting and saying, I don't care about the test. She just had a baby 2 days ago. She got one done then. We're not waiting for the test. If they have a problem with it, they can call me after. And yep. And then thank God she was there. And we were wheeled off. I hadn't received any blood yet at that point. And we were wheeled off, and I remember kind of passing out, and I kind of remember anesthesia counting down or alphabet. It's all a blur, but you know how you see those medical dramas, and it's so different to see it from first person point of view, like looking up and seeing the lights in your face, and it's so different. And that was it. The next thing you know, I woke up and I was in a completely different room. When a nurse came in and was like, hi, you're in the ICU. The doctor come in and talk to you. Not my OB, but a different doctor came in and was like, yeah, they did the exploratory surgery and found a cervical tear. He did a DNC and found a cervical tear. They repaired the tear. You've received 6 units of blood and one hanging, like a bag of platelets hanging. She was like, you're going to have to be here overnight. Whenever anyone's had a massive transfusion, you've got to be in the ICU. You can be moved to a regular room tomorrow for observation and then go home the next. So, yeah, because of all the medication, like the morphine, thank goodness they gave me that morphine. That pain of the hand reaching up there was insane. I couldn't breastfeed, so they brought me a pump so I could pump and dump, which me. But then I was like, well, what's happening with the baby at home? We didn't have any formula. We had nothing at home. I didn't even take the formula home that they had given me from the hospital. I was like, it's okay. We don't need it. Give it to someone who might need it. Like, I was like, it'll be fine. But thankfully, my husband's friend had a baby maybe 6 months before and was breastfeeding. So she brought over some milk for our daughter. So she got breast milk and was fine and happy. And we went home, and I had never been so thankful for life. And I remember thinking, this is how women 100 years ago died. Yeah. And it was, trauma was hard. And obviously, it's still with me.
Yep.
Yeah. My husband, maybe 2 months after everything was finally going good again, I was feeling healthier. I did go to see a hematologist to try and figure out why I had bled so much, because My OB was like, I don't know why you would have bled this much. The cervical tear didn't seem like it would be large enough to cause this amount of bleeding. But go see a hematologist just in case. I did, got all the testing done, and they found no reason behind it. It's just a medical mystery, apparently. But I was feeling healthier and happier, and things were going well. And 3 babies, and I've lost that 25 pounds. uh, so I'm happier and healthier now. I still struggle with incontinence when I laugh, when I sneeze, when I run. Like there's always incontinence. I wear daily liners, and I wish there was a way for it to get better. But I feel like
I know.
I know. You know. So I'm glad I'm having this conversation with you because I want it to be better. I want to, like when I go swimming, like I go to the swimming pool with my kids, I'm not going to wear a liner, but then I'm also like, oh my gosh, I better not sneeze or cough or laugh because if I do, I'm going to pee myself.
Mm-hmm.
And I don't have a liner on because I'm at the pool. So, yeah, I need to figure out how to rectify that issue because I feel like that's really the only issue that I'm having now. Everything else seems back to normal.
Mm-hmm.
That and my droopy boobs from 3 breastfeeding sessions, 3 breastfeeding kids. But, that I feel like that's a natural part of life, whether or not I breastfed.
Right.
Gravity will run its
yeah.
course. Yeah. But the incontinence is
Fixable.
troublesome. It is fixable, I
It is
hear.
fixable. Yes. Part of the reason why I'm doing this podcast, part of the reason why I'm writing this book is because a lot of women just suffer not knowing that there are treatments out there for it. I mean, you have scar tissue in your pelvic floor, for one, from, 3 vaginal deliveries. You have, the pelvic floor muscles probably aren't contracting quite the same. There's different tensions within the walls of the vagina sometimes that can um, create a situation where it's more likely that you leak when you sneeze, cough, laugh, run, whatever. Um, but yeah, pelvic PT can often fix that type of thing.
I think I need to look up information about it. I don't even know what pelvic PT is.
Yeah, there's therapists like me out there that have specialized in working specifically with the pelvic, prenatal, postpartum, pelvic pain, pain with intercourse, all that kind of stuff, working with the abdominals that can sometimes struggle to get back together after giving birth. There's so many things that can happen to a body. I'm also working with a lactation consultant and a speech pathologist on teaching other therapists about how to treat breast and latching issues. So working with the breast, working with the baby. So there were like so many things, but those of us that work in pelvic PT and there may be OTs as well. We work on bowel, bladder, and sexual dysfunction. So whether your issues are with, peeing when you want to, not peeing when you want to, pooping when you want to, not pooping when you want to, and sex being good, orgasm being good, all those fun things that should be happening. Sometimes prolapse, things falling down within the pelvis can be an issue for a lot of women as well. We work with all of those things. So, yeah.
Okay, so I need to see.
You need to see
someone like you.
Yeah, somebody like me. You can Google it for whoever's in your area. I'm going to be a snob and say stay away from somebody who's just going to treat you online. I'm kind of not okay with the online only thing.
What I would probably do as well. I like in person more than online anyway.
Yeah, because somebody is just going to talk you through some things and give you some exercises to do without actually physically evaluating you. I really disagree with that philosophically because we find so many things that are going on with people that aren't necessarily what they seem, having that conversation with somebody, once they get on the table, it's like, oh, well, now I see why you're having that problem. So yeah, find somebody in your area um, who can actually physically assess you and treat you, and are big into the hands-on kind of things.
Do I go to my primary care physician first to get that information, or do I
They may or may not,
maybe?
primary care may or may not know. Even OBGYN, gosh, hopefully these days, no. It depends on where you live in the country, because um, some OBGYNs really poo-poo pelvic PT, and unless
Mm,
they really are getting to know the pelvic therapist in their area, they don't know who to refer to,
mm.
because your youngest was born years ago, so you should have been referred already. These conversations
I
should have been
think
had.
I think that the conversation isn't had because when you go to the doctor, they ask, "How are you doing?" And I feel like most people are inclined to just be like, "I'm good.
Fine,
I'm fine.
yeah,
I'm fine." And that's what I've been saying for years. And I feel like many women are saying, "I'm fine," when in reality, maybe we're just thinking, I'm just thinking this is a part of motherhood. This is how it's supposed to be. Like, this is a side effect of motherhood. You get these beautiful babies, but you pee a little bit. And I feel like many women probably feel the same way I do because we just don't. Thank you for
yeah, yeah.
having to
It's
shed light on that.
Yeah, and a lot of people, because I know for years and years, it drove me nuts, because I've been doing pelvic work for over 20 years. And initially speaking to particularly OBGYNs about it, they would just kind of roll their eyes. And I'm like, look, refer your women out. They don't need to suffer with this. And, a lot of them would at that time, fewer and fewer, thank God, are poo-pooing their patients like, you'll be fine, you'll get better, because here you are years out and still not better. So a lot of people for years and years and years have just assumed, well, I had a baby, these are the consequences, I'm going to live with them.
Yeah.
And it's not the case. Not the case. You can have some residual things, but a good portion of things do have treatments available for them. So,
Oh,
like
thank you.
for the more severe cases, there are surgeries. For the more moderate, easier cases, there's PT. Acupuncture has even been found to be
Hmm.
helpful for some people. Chiropractic works. So, whichever tends to, where do you want to, what direction do you want to go? There are options out there.
Thank
So,
you.
is there anything else that you would want to, just kind of close with and to let people know about?
I don't think so. I feel like pregnancy and postpartum is so different for every woman and then so different for every single pregnancy. I'm not sure there's anything I can say because it's every woman is going to be different. I don't think I have no advice. I have no knowledge. Every pregnancy is so different. Every woman is so different. I just wish everybody luck.
Mm-hmm.
They have healthy pregnancies, healthy babies, and healthy postpartums.
Yep. Well said. Well said.
Happy, healthy, and happy.
Yes. Yeah. Well, you had just a wonderful amount of information to share, Bev. I thank you so much for sharing
Thank
all of
you.
your stories, and I hope that helps
Thank you.
somebody
And I
else
hope
out
this
there.
is, yeah, I hope this is beneficial for others. Like I said, everything's different for each person, but to be able to hear stories that are shared from others. And I love hearing stories from other people's pregnancies as well. And I think that I would have benefited from hearing stories like this when I was pregnant with my first, because I didn't know enough about pregnancy or postpartum or processes or like my rights. I didn't know a lot of that stuff, and I didn't go in search of it. It's good for women to talk about it, to be able to hear others, get those different perspectives.
Mm-hmm. Yeah.
I thank you for doing what
Oh.
you are doing, and when the book comes out, let me know.
I certainly will.
We'll buy it. I would love to pass it on to others. And even when my daughter is getting old enough. Actually, one of my best friends right now is pregnant. So if you're publishing in the next 5 months, let me know.
No, not yet. Not yet. That'll be a little while.
Yeah.
Maybe for her next one.
Okay.
Okay. Well, and for everybody out there, I hope you all found this helpful as well. And thank you very much for joining. We'll see you next time on the Postpartum Years podcast. Bye.